The fetal position, that means what position the baby's in inside your body, really affects how your birth goes. It will affect the length of your labor, the pain or intensity of your labor, what interventions are used, and even if you have a vaginal or a caesarean birth. The position can change during pregnancy. It can also change during labor, but it adds a lot of hours and a lot of discomfort to labor. So, of course, the best time to get your baby into the optimal position is later on in pregnancy, somewhere between 32 and 37 weeks. The optimal fetal position is this one here, where the baby's head down and the back is either out or sort of off to the side at the front. This is called posterior or sunny side up. This is a really difficult position. And the reason for that is the hard part of the baby, like the head and the back, are against the hard part of the pregnant person. When our baby's in an optimal position, so head down, you'll notice here that the tummy and the soft parts of the baby are against the maternal spine. Now, when the baby's posterior or sunny side up, then the hard parts of the baby are against the spine. And this can cause a lot of problems in labor. It can lead to a lot more pain and discomfort. It can lead to extra hours or days of labor because our body is smart and it's going to try and get that baby turned around. Because the other thing about having the baby in the optimal position is it's actually a smaller diameter on the head that has to come through. And nature will try to get the baby to turn around. So you can spend hours laboring to get the baby turned around, or you can start labor with the baby in the good position. So you'll ask your doctor or midwife, where's the baby's back? Because if you just ask what position is my baby in, they're often going to say, oh, head down, good to go, you're good to go. But we really want to know where the baby's back is. And a way for you to remember, like, oh, is this a good position or not, is if you're rubbing your belly anywhere, whether it's right on the front or a little off to the side, if you're giving your baby a back rub, then your baby's probably in a pretty good position. Birth is a little bit of a dance of getting, the pelvis and the baby moving, and it just works so much better, faster, easier when the baby is in this optimal position. There's a document called Optimal Fetal Positioning, and that gives you some websites, including spinningbabies.com. And then there's a thing called the Mile Circuit. There's a website for that too. And that's a series of exercises you can do to help keep your pelvis healthy for birth. Spinning Babies has lots of recommendations for things you can do on your own to get your baby into a better position. And the reason you have so much control over that is because sometimes the baby's in a funky position because of ligaments or connective tissue or some reason that something's tight and it's going to keep the baby turned. And if you can address some of these things, then your baby's probably going to turn into a better position. There are also healthcare people who can help you with that, chiropractors who do Webster technique, acupuncturists. If you're working with people through pregnancy, make sure they're actually trained to work with you through pregnancy. Sometimes when you ask your healthcare provider, what position's my baby in, I've heard of some who say, well, I'm not going to tell you because it can change. Well, yeah, it can change. So just ask them right now, today, where is my baby's back? Because that's a really important part of your preparation. If you go into labor with your baby in a posterior position, some women do just fine. You wouldn't even know it. But for others, they have all those extra hours or days of labor. And then they can have a thing called back labor, 2 to 5 or 10 minutes in between contractions when you're supposed to just feel normal again. There's this terrible back pain. If you've ever met anyone who said they have back labor, that's what that's about. So just make sure you find out where your baby's positioned and then do things to get them in the optimal position if they're not already.